My name is Larry Helzel, and I saw Dr. David Jackson. Almost overnight, I started experiencing lower back pain for the first time in my life. And it wasn't an accident or any trauma that set it off. I just literally woke up one day with it and I was in pain.
Before surgery, Larry was quite disabled. He had difficulty standing up straight. Because of that, the muscles in his back had to work very hard anytime he was standing. Additionally, he had a lot of pain going down his legs from pressure on the nerves.
One of the things that my wife and I enjoy doing together is bicycling. And one of the big impacts is I was no longer able to keep up with her. And so one of the things that we enjoyed doing the most together, we were no longer able to do because of my pain.
Larry's problems had been going on for years before he came to me. They'd been treating him with therapy, injections, and anything he could do to try to avoid surgery.
Prior to surgery, I was in extreme pain, and I had gone through a course of 15 months of various steroid injections, and it came to the point where they weren't having any effect at all.
Larry came to me after he'd seen many doctors and had many recommendations for what really is a rather complicated problem. He had a condition called degenerative scoliosis, which was quite severe, and he was looking for any alternative to a traditional large fusion procedure.
I sought out Dr. Jackson originally as a second opinion. I went first to a university hospital, and the famous physician at the university hospital looked at my x-rays and immediately recommended that I have a 7-level fusion.
The traditional treatment for this is a long fusion, usually from the middle of the thoracic spine or the upper back, all the way down to the pelvis. While this would treat his symptoms, it would make it difficult for Larry to return to the activities he enjoyed, and frankly, many patients who undergo this big traditional surgery have a lot of pain after the procedure.
This was going to be a very debilitating operation. When I had a conversation with Dr. Jackson, he looked at me as a patient, and the first thing he did was ask me what were my goals. What did I want out of life?
Well, when I first met Larry, I was impressed by his expectations. He is a very active gentleman, bikes, hikes, swims, any sport someone his age could possibly participate in, he wants to participate in, and he just couldn't because of his back.
And I told him that what I wanted was to be able to return to as much as my active lifestyle as I could. That I wanted to be able to resume cycling with my wife and to continue to enjoy hiking and swimming and our active, and especially traveling, and that this is what I was interested in doing.
It was very important to Larry to retain as much function as possible and to get back to as many activities as he could.
So as a result of this, Dr. Jackson suggested that I would be much better off with a 4-level fusion, which would be much less debilitating, which if the operation was successful, I would be able to resume most of these activities that I wanted, and that I would be much happier than if I had the 7-level fusion.
Larry really had a combination of 3 procedures performed. He had an anterior interbody fusion performed at the lower aspect of his spine. He had a lateral interbody fusion performed at the upper part of his lumbar spine. And then he had a posterior instrumentation and fusion performed throughout his mid to lower lumbar spine. This was all done in a minimally invasive manner. We selected these surgeries because I wanted to find a way to correct Larry's primary issue, which was pain and disability, without doing a large open procedure that would have limited his ability to participate in the activities he enjoys.
The thing that I think the most outstanding thing about Dr. Jackson was his interest in me as a human being and his wanting to know what my goals were in terms of the life that I wanted to lead after surgery. He really cared about me, the person, rather than just my spine.
Well, everybody's a little different, especially in patients that have as complicated a problem as Larry. But patients that undergo even multi-level interbody lumbar fusions often are surprised at how quickly they can recover. I generally don't require any kind of brace for these patients. I get them up out of bed the very next day. Their pain is often easily managed with standard oral pain medications. We do restrict activities for about 3 months while the bones are healing, but after that I let patients get back to doing pretty much whatever they want to do.
Well, I've been able to resume most of my activities. I'm back hiking and biking and swimming, and I'm a much better companion to my wife, and so it's been a tremendous benefit. In terms of my daily life, there's been a huge improvement of my ability to sleep and to sleep soundly, and that's very, very important. Prior to the surgery, because of the pain, every time I would toss and turn, I would wake up, and I wasn't getting much rest at all. Another big change is I was taking a lot of drugs prior to the surgery, and now the only drug I take is Tylenol, and I'm very, very happy with not being on any drugs.
I've really enjoyed getting to know Larry. Patients like Larry have helped solidify my belief that you have to tailor each surgery to the specific patient. Larry's problem was very complicated, and instead of doing a traditional large surgery to correct everything that we saw on his x-ray and make his back perfectly straight, we tailored a much smaller and less invasive procedure to fit his needs, and he's done very, very well. I try to take this approach with all my patients.
I think that Dr. Jackson, in addition to being a very talented surgeon, is a wonderful human being.